I'd like to talk to you about a new mobile neuropathy treatment program available in Colorado. So Colorado obviously is a very large state, and having a mobile program to treat pain is probably an extremely valuable service for many people that live there. Most of you out there understand the details of neuropathy. Chronic peripheral neuropathy is there's a range of causes. There's also a range of symptoms. Many people experience pain, burning, and tingling. Some people it's numbness and obviously the risk of neuropathy is there's a lot of risks. It's difficult to walk, to keep your balance. There's a lot of problems with neuropathy. One of the other aspects of that is that if you are working with a doctor or an office or a group, getting to the office there and back creates a pretty major issue. It's a pretty difficult endeavor to get in and out of your car and house and home into the office and get treatment. So that's one of the reasons why a mobile treatment program for neuropathy is so valuable. So what are we doing? What is the actual treatment? So this is called neurofunctional pain management. This is a combination therapy that uses high pulse electroanalgesic therapy combined with an IV nutritional therapy and health coaching. This combination is extremely successful at getting people out of pain across the country, with thousands of patients being treated with this exact treatment program. We've seen an 85% success rate of getting people out of pain. This is a number that we've established by talking to the doctors who have performed the treatments on patients across the country. We would ask them. So it's a subjective number. We ask them, in your opinion, doctor, what is the success rate of treating patients with this program? And they'll tell us, oh, I see probably about an 85% success rate of getting people out of pain and achieving a greater than 50% reduction in chronic pain associated with most all, across the board of all the different pain conditions we treat. There's a couple dozen different types of pain we can treat with this program. So we would talk to these doctors and work with them on that, determine this, but a lot of them have actually seen extremely successful results with patients. Out of all of those patients, say out of 100 patients with an 85% success rate, we're seeing somewhere 30 to 40 of those patients probably had all of the pain resolved, like completely resolved, and they're telling us that they feel great. There's no pain. They walk around. So it's a wonderful program for that. You get people out of pain without medications and surgery and invasive procedures. And that's something that I, love to point out too. This is a non-pharmaceutical program, so there's no medications involved. It is non-surgical. It's non-invasive. There's no spinal injections, no steroid injections. So it's safe, it's effective, and it's covered by Medicare and commercial insurances. So you can get this treatment for your chronic pain. So going back to the three components, we got electroanalgesic therapy, which is a very useful and valuable technology and therapy for treating pain. It's been in the market for 30 something years now as an FDA cleared treatment for chronic pain. So some of the things that it's doing, it's depolarizing pain neurons. So it's inhibiting the pain signal. It's relieving it's turning off that pain inflammation cycle, or at least inhibiting it. So normally you have pain, your brain feels the pain, it creates a inflammation, and then that inflammation triggers more pain, and then that cycle continues. Electroanalgesic therapy can actually reduce that cycle or eliminate that cycle. That's part of how it relieves pain. Additionally, the high pulse electrical therapy will actually release the neuropeptides and neurotransmitters in those nerves. You're looking at a range of different neuropeptides and transmitters. A lot of them do make you feel better and feel great. That's assists in helping people get out of pain. It also helps people feel more energetic and lively and ready to get out and tackle the world because they feel so much better. And also they're getting out of pain. So electroanalgesic therapy is extremely valuable in this concept. And again, it's been FDA cleared for 30 something years. And I have a lot of people ask, well, if it's so great, then why aren't doctors using it like everywhere? So my answer to that is that there are doctors that use it all over the country. There's just a very few of them. And the reason for that is that most pain doctors nowadays, after the opioid epidemic, well, we're in it now, but for years now, there's been a lot of negative attention on medications and prescriptions and things like that. So most pain doctors are trying to focus and emphasize on other methods, and that becomes what's called an interventional procedure. They're doing spinal injections and ablations and surgeries and implants of devices and all these things. Those are all interventional procedures, and most pain doctors are focused on that. And there's value there. Like I tell everybody, there's a need and a reason for everything that all the physicians out there do. So there's nothing wrong with those things, but not everybody wants those things. Just because everybody knows that this surgery can do something for you, not everybody wants to get that surgery, right? It's an undertaking. It's scary. There's risks involved. So it's not for everyone. Also, too, medications. Everybody knows medications can do a lot of things. Doctors prescribe medications just to try and see if it works for a patient and then move to the next one, move to the next one. Not everybody wants to do that. And if they had an option to pick, I guarantee you most patients who are watching this video would say, if I could avoid medications and if I could avoid surgery and if I could avoid invasive procedures and still have something that worked extremely well to get me out of pain, I would do the other thing, right? And so we've seen that all over the country. Patients, if they have a choice for this, they'll pick this. So electroanalgesic therapy, amazing at getting people out of pain. You're looking at chronic peripheral neuropathy being what we're talking about here, and doing it now in a mobile program, sorry, in the state of Colorado. So it's a wonderful addition to your state to have a mobile program that can come to you and treat you for pain. So that being said, the second category of neurofunctional pain management is the IV hydration. Most chronic pain patients, talking to doctors across the country, significantly dehydrated, chronically dehydrated in many cases. Dehydration actually helps the pain process. It helps the inflammation process. So you do want to hydrate and stay hydrated. So the IV itself assists with that aspect of your physiology. And of course, the vitamin and mineral mix that's in that IV does also help, because many people are struggling with nutritional deficiencies. And I hear that word, and I've talked to people, and they think, oh, okay, oh, they are still eating food. Well, that's not exactly what I'm talking about here. We're talking about the variety of vitamins and minerals that they should have in concentration in their body. And there's a lot of scenarios in which patients just don't have those things that they need, or enough of them. So the vitamin mineral mix IV does make people feel, it makes them feel great, alive, energetic. I feel good, so people do love the IVs, and the combination of electroanalgesic therapy and the IV is very strong. So over the years, we've noticed some doctors will do just the electrical therapy. Other doctors and providers doing wellness IVs and things will have patients that also get out of pain just with the IVs. And then over the years, we determined that if we combine those two things, they're an enhanced outcome. So the combination of these two things works amazingly well. And, we've seen a lot of great success with this over the years as well. And the third component of this is health coaching. All the nurses that come out and treat you in your home, they will conduct a short health coaching session with you during your treatment, because each treatment is an hour long in your home. And they'll work with you on a single topic of health and wellness, and actually work with you to achieve those goals. Because we've noticed that as patients get out of pain, they typically want to continue getting out of pain, and they want to stay out of pain. Luckily for us, if a patient completes our entire program, and our program is an 8-week program where the patient's being treated twice a week in their home for an hour each time. So you're being, treated twice a week for an hour each. And if you complete that whole 8-week program, the average patient will continue to see a success rate or a success outcome of 3 to 6 months. That's been our observation over the years. Do the whole program, 3 to 6 months of pain relief thereafter. Most patients will have some sort of duration of effect for a period of time. I've seen patients go over a year. So it depends. Some patients obviously don't get out of pain at all. There's a handful of people out there who just aren't very receptive to the treatment. So they didn't get out of pain during treatment. They don't have hardly any success afterwards, right? There's very few people that have had that happen. Almost everyone getting treatment has some degree of success and relief. It's just how much, relief did they achieve during the program. Another aspect of this is there's a cumulative effect. If you were to do one treatment with electroanalgesia and you stopped, you might have a day or two of relief, might help for a little while. You do 2 or 3 treatments in a row, and you might have several days to a week or more of relief afterwards, after that last treatment. If you do this for 8 weeks, doing it twice a week, we've observed that patients can have months and months of ongoing pain relief. So it's amazing that that can work. And again, that's without medications, surgeries, or invasive procedures, and you're still achieving that success. So that being said, that's the 3 components of neurofunctional pain management: electroanalgesia, IV nutritional hydration, and health coaching, with an 85% success rate at getting people out of pain for a wide variety of conditions. Specifically, right now we're talking about neuropathy in Colorado, being a mobile program that comes to your home and treats you on site. Oh, and did I forget to mention this? This entire program is the entire treatment program is covered by Medicare and commercial insurances. So you can get this covered by your insurance as well. And the nurse will come to your home and treat you for this pain condition. I have a link in my content on the video here where you can go and submit your insurance and see if we can get you covered and get you treated. Find a mobile nurse that's near you. Again, we are the RELATYV Mobile Pain Treatment Program, and we are now offering a mobile pain treatment for peripheral neuropathy in Colorado, and we look forward to working with you. Thank you so much.